Have you ever noticed, maybe over the last year or so, some subtle changes in an elderly loved one? Things that made you pause?
Yeah, it happens. And we often assume, don't we, that death in old age is sudden, like it just happens out of the blue.
Exactly. But our deep dive into this, looking at the research, it tells a pretty different story. The body often sends out these quiet signals, these warnings, sometimes months, maybe even a full year before the end.
Hmm.
But the trouble is, these signs can seem so small at first. Easy to just brush off as, oh, they're just getting older.
It really is striking. Families often look back and say, the clues were there. They see it in hindsight.
Right.
But, by then it can feel a bit late to really prepare properly or make those last memories really count. So this deep dive, it's really about helping you spot those signs sooner. We're focusing on 5 key things that can show up about a year before someone passes.
Our goal here is really to give you a shortcut, to help you get informed so you understand what might be happening. That way, you're not caught completely off guard. You can approach this time with, well, a clearer view. Make the most of the time you have left and really ensure that final stage is about comfort, dignity, and peace.
Yeah.
We've looked at quite a few sources for this, and we're ready to sort of unpack it all.
Let's do it.
Okay, so let's start with this first one. Significant weight loss. But the key here is unintentional.
Right.
It might be really subtle initially, like a belt suddenly needs tightening another notch, or clothes just seem looser.
Or maybe they used to have a really hearty appetite, and now
Yeah.
not so much. It fades.
Yeah, exactly. And it's so easy for families just to think, well, that's just part of getting older, but there's more to it, isn't there?
Oh, definitely. The deeper insight here isn't just about, not eating enough. It's a fundamental shift happening inside the body.
Mhm.
When an older person starts losing weight without trying, it often means the body isn't absorbing nutrients properly anymore.
Mm.
Muscle mass starts decreasing, key systems slow down. Now, sure, aging itself involves some muscle loss, but if it's rapid, unexplained,
Mm.
that points to a bigger metabolic change. The body's sort of switching priorities
Switching priorities from what to what?
from, building and maintaining
Yeah.
to preservation, basic preservation.
That's a really important difference. So it's not just about how much food they're taking in. What else is going on?
Precisely. Our research showed the body might be struggling to even digest food effectively or process protein, and that leads to muscle wasting, which isn't just about being weaker, though that's
That's
part
right.
of
It
it.
makes falls more likely.
Absolutely. Big increase in fall risk. And it weakens the immune system, makes them much more vulnerable to infections, and it links directly to appetite changes too. Like you said, many older people just don't feel hungry in the same way.
Your sense of taste might fade.
Yeah, taste, enjoyment of food, it diminishes, so they skip meals.
Yeah.
But it's physiological. It's the body sensing it's starting to shut down, so it stops sending those strong hunger signals to the brain.
That makes a lot of sense. And I guess, are there often other health issues hiding behind this weight loss? Things that aren't obvious?
Yes, that's
Yeah.
a critical point. The sources really highlighted this. Significant weight loss is a really common flag for chronic diseases.
Mm-hmm.
Things like cancer, heart failure, kidney disease. These can progress quietly for a long time before other, more obvious symptoms show up.
Mm-hmm.
Even things like depression or, cognitive decline can seriously impact someone's desire or ability to eat.
So if you, the listener, notice this, it really is a message from the body.
It is. And families, naturally, they try to encourage more eating, just have a little more.
Yeah.
But if the weight keeps dropping despite that,
Mm.
it's really crucial to recognize it's probably not just about diet. It's the body preparing for a deeper shift.
So forcing big meals might actually cause distress.
It often can, yes.
Yeah.
At this stage, the focus really needs to shift towards comfort. Small, easy-to-eat things, making sure they're hydrated. It's about quality of life, maintaining dignity.
Okay. So when the body's struggling with nutrients and losing muscle, it naturally hits energy levels hard, which brings us right to our second key sign: extreme fatigue and weakness. And this isn't just, feeling a bit tired.
No, not at all.
It's that profound exhaustion. Simple things feel overwhelming, like getting out of bed is a huge effort.
Or even just cooking something simple, holding a conversation.
Yeah.
It just drains them.
Yeah.
And what's really striking is that this deep fatigue, it's not just a side effect of being old. It's actually a strategic move by the body.
Strategic. How so?
It's conserving its remaining energy. As organs start to slow down, the body becomes really ruthless in prioritizing. It focuses only on what's absolutely essential for basic life support.
So the heart maybe isn't pumping as strongly?
Exactly. Circulation weakens, muscles don't get the same oxygen supply,
Yeah.
and all that leads to this really deep weakness and unsteadiness. Every movement feels like climbing a mountain.
Wow. So the body's basically deciding, okay, this is essential, that's not, and cutting back power everywhere else. Our research also mentioned a metabolic slowdown. How do we see that play out?
Well, that's precisely it. The body shifts from, fueling activity to just core preservation.
Yeah.
And that's why someone in decline might start sleeping a lot more. Really long naps.
Or just sudden energy crashes.
Yeah, sudden dramatic drops in energy, seemingly out of nowhere. Now think about the emotional side of this.
Mm-hmm.
Many older people were fiercely independent, right?
Mm.
And now they feel this deep frustration, maybe even embarrassment that they just can't do what they used to.
That must be so difficult.
It is. And it can lead them to pull back from social things. Not because they don't care, but just because they physically don't have the energy for it.
Which can lead to isolation?
Sadly, yes.
Yeah.
It can spiral into significant isolation.
And for families watching this, it's just heartbreaking. It's easy to misunderstand, maybe think they're being lazy or try to push them to be more active.
Right, come on, let's go for a walk.
Yeah. What's the better approach here? How should we reframe that?
The sources really strongly suggest that trying to force activity or push engagement at this stage, it often just backfires. It can cause more stress. The most important thing, really, is to understand their limits are shrinking rapidly. Allow them to rest without making them feel guilty.
Okay.
And just focus on making their days as comfortable, as dignified as possible. At the end of the day, it's about making sure they feel loved, understood, and, at ease, whatever their physical capacity is.
It's about presence, not pushing.
Exactly.
Well said. So as the body conserves physical energy, that slowdown often affects the mind too, which leads us to our third sign, increased cognitive confusion or maybe withdrawal. You might see someone who is always sharp starting to forget things more often. Maybe they struggle to follow a conversation.
Or seem confused, even disoriented in places they know really well, their own home perhaps.
And these changes can start quietly, maybe months, even a year beforehand.
Yeah, and this isn't just, normal senior moments or everyday forgetfulness. It's different. As that circulation weakens, less oxygen gets to the brain, and cognitive function just it inevitably declines.
So they might get confused easily.
Very easily.
Yeah.
Difficulty making simple decisions, maybe trouble recognizing people they know well. And what can be really challenging for families is sometimes they might have these moments of real clarity, surprisingly lucid,
Oh, wow.
followed by sudden, quite deep confusion. It can be really disorienting for everyone.
I can imagine. And then there's the withdrawal part, the emotional pulling back.
Yes, someone nearing the end might just lose interest in socializing. They talk less, engage less.
Spend long times just being silent.
Right. And it's crucial to understand why. It feels personal, but it often isn't.
So why does it happen?
It's not a choice, usually. It's not that they don't care.
Yeah.
Their brain just isn't processing emotions and engagement the way it used to. Conversations become exhausting. Loud places can feel completely overwhelming.
You might see mood swings too.
Definitely. More irritability, maybe anxiety, or sometimes the opposite, this unusual sort of calmness or indifference. It's not just their personality changing. It's the brain adapting to the body's decline, conserving that precious mental energy.
For families, seeing a loved one kind of lose touch or pull away like that, it must feel like you're losing them before they're actually gone.
It's incredibly painful.
What's the most compassionate way to react when someone seems to be receding?
Well, the sources really stress remembering they can't control this. So instead of trying to pull them back into our reality, maybe.
Meet them where they are.
Exactly. Meet them where they are. Speak gently. Offer reassurance just by being there consistently. Understand that even if they don't always respond or seem to know who you are in that moment, they can often still feel your presence, your love, your comfort.
Sometimes that quiet, steady presence is the most powerful communication.
It truly can be.
Okay, so as the body winds down, the immune system takes a hit too. Which brings us to sign number 4. Frequent infections and much slower healing. You might notice someone who was hardly ever sick before suddenly seems to catch every cold, every flu bug that goes around.
And recovery takes much longer. What used to be a minor thing just lingers.
Even simple cuts or bruises, they just seem to take forever to heal, noticeably slower.
Mm-hmm. And what the sources really make clear is that these aren't just random events. They're direct signs the body can't defend itself or repair itself like it used to. You see repeated infections becoming much more common. Things like pneumonia, UTIs, urinary tract infections,
Skin infections, too.
skin infections, even infections in the mouth. And sometimes even antibiotics don't seem to work as well. They might need stronger drugs or just longer recovery times.
And you mentioned slow healing. Our sources talked about chronic wounds. Why do small cuts or sores sometimes just not heal or keep reopening?
That's usually a direct result of poor circulation. If blood flow is compromised, oxygen and nutrients just aren't getting to the tissues properly.
So healing becomes really difficult.
Exactly. It's a much slower, tougher process. And this also makes pressure sores, bed sores, a really serious risk, especially if someone isn't moving much.
That's a key point.
And here's something else that's really important. Infections in this final year, they often don't look like we expect.
How so? No high fever.
Often, no. Instead of a high fever, the person might just seem much more tired or more confused than usual, or just lose interest in eating. Sometimes, a sudden downturn in their mental state, their alertness, is actually the first sign of an infection, before any other classic symptoms appear.
Wow, that's crucial to know, because for families, dealing with infection after infection must be so frustrating. You'd be tempted to push for really aggressive treatments, right? To fix it.
It's a natural instinct. But the wider view here is that at a certain point, the focus often needs to shift. It moves away from curing towards comforting. Treatment might still play a role, of course, but the main goal changes. It's less about prolonging life at absolutely any cost and more about the quality of that life.
So simple things become more important.
Very much so. Simple, consistent care, like making sure they're hydrated, keeping their skin meticulously clean, minimizing stress. These things can often do more for their actual well-being and dignity than, say, another tough round of medication that might just prolong discomfort.
Okay. That leads us to our final sign, and this one involves really fundamental bodily functions, breathing and circulation.
Yep.
Major changes here are often very telling.
Yes, very.
You might notice your loved one is breathing more slowly, maybe more shallowly, or their breathing becomes irregular, speeding up, then slowing right down.
You might even see a very specific pattern. It's sometimes called Cheyne-Stokes respiration.
What does that look like?
It's this unique kind of rhythmic pattern. Breathing gets deeper and faster for a bit, then it gets shallower and slows down, followed by these long pauses where they might not breathe at all for, say, 10, 20 seconds or even more.
Wow.
It's a very clear physiological signal that the body's systems are slowing right down.
And the circulation changes.
Yeah. Another common sign is noticeably weaker circulation. Hands and feet might feel cold to the touch.
Even the nose or ears.
Yes. They might look pale or even bluish, maybe mottled, especially around the fingers and toes.
And why does that happen? Why does the body start shifting blood flow away from the hands and feet?
It's that prioritization again. The body is sending the blood flow to the most vital organ's brain, heart, because the heart just isn't pumping as strongly anymore.
So it reduces flow to the extremities.
It's a natural part of the process.
Yeah.
And you might also notice shortness of breath. A lot of people experience this, even when they're barely moving.
They might breathe through their mouth more.
Often, yes. Or suddenly need to gasp for breath just while talking. Lung function declines. Sometimes fluid can build up in the lungs, too.
Causing a cough.
A persistent cough, yeah. Or sometimes gurgling sounds when they breathe. That's sometimes called a death rattle, though it's often not distressing to the person themselves. Or just a feeling of tightness in the chest.
Seeing these kinds of changes, especially the breathing changes, must be incredibly frightening for families.
Oh, absolutely.
It's so natural to feel panic, to think something urgent needs to be done right now.
It is. But the deeper understanding, again, is that in many situations, this is simply the body's natural, often gentle way of slowing down. It can be very distressing to watch, no question. But there might not always be a way to reverse these changes medically.
So the focus shifts again.
Entirely. It shifts to comfort. There are definitely things you can do to make them more comfortable.
Yeah.
Simple things. Keeping the room cool can help. A humidifier might ease breathing, offering small sips of water or ice chips to suck on. It's all about easing discomfort, maintaining dignity, not trying to fix something that's part of a natural process.
Right, so maybe the most important thing you can give isn't more medical intervention.
Often, no. It's your calm, reassuring presence. It's helping them maintain their dignity. It's the profound knowledge for them that they aren't alone in this.
Okay, so let's bring this together. What does this all mean for you, the listener, when you're navigating these really difficult personal times?
Right.
We've talked through 5 key indicators today. Significant unintentional weight loss,
Profound fatigue and weakness,
increased cognitive confusion or withdrawal,
frequent infections, and that slow healing.
and finally, those major changes in breathing or circulation.
And as the sources point out, these signs often cluster together, appearing in that last year or so. Maybe not all at once, maybe not obviously at first, but when you start seeing these patterns emerge, it's a pretty strong signal the body is gently preparing for its final transition.
And it's so natural, so human to want to fight it, isn't it? To push back against these changes, encourage them to eat more, move more, just push through the tiredness, hoping somehow you can turn it around.
Of course. But sometimes, maybe often, the most loving and actually the most helpful thing we can do is to really listen. Listen to what their body is communicating. Instead of focusing all our energy on trying to reverse what might be inevitable, we shift. We shift our focus entirely to making the time they have left as peaceful, as comfortable, and as meaningful as it can possibly be.
Understanding these signs, then, it isn't really about being afraid of death. It's about being prepared for it. Prepared with knowledge, with compassion.
Exactly.
It gives you the power to offer better care that's actually aligned with what's happening. It helps you make important decisions ahead of time and ultimately ensure that their final months are filled with love and dignity, not confusion or distress.
It really allows for a kind of sacred time, doesn't it? A time for cherishing moments, for sharing stories, for letting them know deeply that they are valued, that they are not alone. Maybe the deepest way to understand these signs isn't just about predicting an endpoint. It's about transforming the journey itself, shifting our focus away from just prolonging life, whatever the cost, towards enriching the actual essence of their life right now, focusing on presence, comfort, shared love right to the end.
That understanding lets us truly be there.
Yes. Not just watching, but actively participating in creating a legacy of peace for them. And for ourselves, too, I think.